Welcome back to Smitty's Learning Room. This video is the first video for the HSC option Sports Medicine, and we're going to have a look at how do we classify injuries. So when we look at the syllabus, we look at the focus question, how are sports injuries classified and managed? And we look at the first dot point, ways to classify sports injuries. So we're going to look at direct and indirect injuries, soft and hard tissue injuries, and overuse injuries. So, when classifying sports injuries, they can be classified based on their cause, their type, and their history. And classification of injuries allows us to identify the correct treatment and appropriate rehabilitation program if needed. So by the end of this focus question, you should be able to answer questions around why is it important to classify injuries? Why do we need to classify these injuries? And so when we classify sports injuries, we can sort of do them into three groups. So we have direct and indirect injuries. So one is one and the other one's the opposite. We have soft or hard tissue injuries, or we have overuse injuries. So we'll start by having a look at injuries that are classified by their cause, and so that's either an internal or an external force. Now, a direct injury occurs when an external force, such as an object or player, impacts on the athlete. So for example, here we have a look at our soccer players, and one player's got the ball dribbling and the other one's going in for a tackle and has actually done an illegal tackle and put their stud into the shin of the player. And so that would be a direct injury because the force of the other player's foot has caused an injury to the other player. When we look at indirect injuries, these are when internal forces impact, usually due to a lack of technique, skill, fitness, or equipment. And so this might be when we're changing direction, or if we land funny, or if we've got the wrong shoes, or we've got the wrong mouth guard or something like that. It's when something happens to our body that hasn't happened as a result of an external force. So for example, when we tear a ligament changing direction in basketball or something like that, that's an internal force of the ligaments and tendons working there, and so it's an indirect injury. So the next ways to classify sports injuries are by the type of injury. So the type is related to which type of body tissue has been injured. So relatively simple, we look at soft tissues and hard tissues. And soft tissue injuries are injuries which are related to tissues in the body. So for example, muscles, skin, ligaments, and tendons. And we'll have a little bit more of a look at soft tissue injuries in a later video. And then hard tissue injuries are related to injuries with the bones or teeth. So pretty easy to remember. Parts of the body that are hard, that's a hard tissue injury. Types of the body that's soft tissue injury. And the final classification we classify injuries as is an overuse injury. Now, these are injuries that can be a result of several things, such as a repeated force impacting on the body. So for example, a runner constantly running on hard concrete might end up with an overuse injury to their feet or their knees as a result of that repeated impacting force. Ill-fitting sports equipment or uniform. So if an athlete's wearing a pair of shoes which don't suit their feet and they wear them for quite a period of time, this can cause issues in their feet. Or a repeat of incorrect or poor technique. So if someone's in the gym and they're using the incorrect technique for a deadlift, and they're consistently using that can actually cause the body some serious harm and have an overuse injury as a result of that poor technique. So remember, when we classify sports injuries, we classify them as a direct or an indirect force impacting on them. The type of tissue, so by type, so looking at soft tissue or hard tissue, or if it's an overuse injury, overuse of the muscles or equipment or incorrect technique.